The mystery virus started here in the city of Wuhan. Dozens have been infected, but experts here believe the actual figure is closer to 1,700 cases.
We're going to begin here with the outbreak of a mystery virus in China that now has the World Health Organization on edge.
At each turning point, it gets worse. A mystery virus that they'd hoped to contain, but one we now know can jump from human to human.
As China prepares for its busiest getaway, concerns are growing about the speed at which a major virus is travelling.
The virus broke out in Wuhan at the end of December, but it's also since been detected in Thailand and Japan.
A dangerous virus is spreading rapidly in China, and U.S. officials are very worried that it could come here.
In Hong Kong, the lessons of the SARS epidemic of 2002 to 2003 mean scientists understand the potential danger of this virus.
The outbreak has prompted an international response. Airports across Asia and the US now screening passengers from Wuhan.
And now a disturbing development. China today says it has confirmed cases.
Declared an international health emergency. But it will take much longer, weeks, even months, to know the scale of this epidemic.
What began as a simple, small virus has changed the entirety of society and continues to do so to this day. I'm of course talking about COVID-19. COVID-19, also known as coronavirus or SARS-CoV-2, is not entirely brand new to us. Coronavirus are a type of virus, some more fatal than others. This new strand, however, SARS-CoV-2, has caused a worldwide pandemic due to the more focused attack on its respiratory systems. COVID-19 was first identified back in December 2019, however no one was aware at the time of how fatal this strain was. To this day it's not entirely clear where this strain came from, though it's believed to have originated in Wuhan's animal markets. With the first few cases in humans being identified in China, they attempted to act fast to prevent the spread. However, that was not the case. With people starting to return to their home countries from China, other cases began popping up around the world too. However, it wasn't until January 1st, 2020 that 2 cases were confirmed within the UK. By then, China had locked down the whole country with cases soaring, and we had identified the virus.
It has been confirmed that there are 2 cases now in England. This is a statement from Professor Chris Whitty, who's the Chief Medical Officer for England. He said, "We can confirm that 2 patients in England who are members of the same family have tested positive for coronavirus. The patients are receiving specialist NHS care, and we are using tried and tested infection control procedures to prevent further spread of the virus. The NHS is extremely well prepared and used to managing infections, and we are already working rapidly to identify any contacts the patients had to prevent further spread. We have been preparing for UK cases of novel coronavirus, and we have robust infection control measures in place to respond immediately. We are continuing to work closely with the World Health Organization and the international community as the outbreak in China develops to ensure that we are ready for all eventualities."
February the 4th saw the UK directing its citizens to return from China if possible, and by February the 11th, the official name of the virus was given COVID-19, an acronym for Coronavirus Disease 2019. Over the rest of February and March, we saw cases continue to rise dramatically all over the world. The first British death happened on the 20th of February, and 442,675 calls were made to the non-emergency line in the last week of February. People began panic buying in supermarkets, toilet rolls especially. 5th of March saw the first death within the UK from coronavirus, which ushered the government to move to the second stage of dealing with COVID-19, from containment to the delay phase. The day after, the government gave 46 million in funding for the research and making a vaccine. But that would be just a small portion of the millions to come. As March rolled by, more and more cases kept rising, even Boris himself. So to counteract this, on March the 23rd, Boris Johnson made an announcement to the entire country.
Good evening. The coronavirus is the biggest threat this country has faced for decades, and this country is not alone. All over the world, we're seeing the devastating impact of this invisible killer. And so tonight, I want to update you on the latest steps we're taking to fight the disease and what you can do to help. And I want to begin by reminding you why the UK has been taking the approach that we have. Without a huge national effort to halt the growth of this virus, there will come a moment when no health service in the world could possibly cope, because there won't be enough ventilators, enough intensive care beds, enough doctors and nurses. And as we've seen elsewhere in other countries that also have fantastic healthcare systems, that is the moment of real danger. And though huge numbers are complying, and I thank you all, the time has now come for us all to do more. From this evening, I must give the British people a very simple instruction. You must stay at home, because the critical thing we must do to stop the disease spreading between households. That is why people will only be allowed to leave their home for the following very limited purposes. Shopping for basic necessities as infrequently as possible. One form of exercise a day, for example, a run, walk or cycle, alone or with members of your household. Any medical need to provide care or to help a vulnerable person, and travelling to and from work, but only where this is absolutely necessary and cannot be done from home. That's all. These are the only reasons you should leave your home. You should not be meeting friends. If your friends ask you to meet, you should say no. You should not be meeting family members who do not live in your home. You should not be going shopping except for essentials like food and medicine. And you should do this as little as you can. And use food delivery services where you can. If you don't follow the rules, the police will have the powers to enforce them, including through fines and dispersing gatherings. To ensure compliance with the government's instruction to stay at home, we will immediately close all shops selling non-essential goods, including clothing and electronic stores, and other premises, including libraries, playgrounds and outdoor gyms and places of worship. We'll stop all gatherings of more than 2 people in public, excluding people you live with. And we'll stop all social events, including weddings, baptisms and other ceremonies, but excluding funerals. Parks will remain open for exercise, but gatherings will be dispersed. No Prime Minister wants to enact measures like this. I know the damage that this disruption is doing and will do to people's lives, to their businesses and to their jobs. And that's why we've produced a huge and unprecedented programme of support both for workers and for business. And I can assure you that we will keep these restrictions under constant review. We will look again in 3 weeks and relax them if the evidence shows we are able to.
With the lockdown being put in place, the whole country ceased to a halt, and the message was given out on the 24th of March, ordering people across the whole of the UK to stay at home, protect the NHS and save lives. With the lockdown, everyone began to wonder about money, with their jobs being put on halt. This was when the furlough scheme was first introduced as well. This meant employers could be put onto the furlough scheme, much like myself, and although not working, still be on the payroll at 80% of your wages, instead of being dismissed. With it now being a year later, the furlough scheme is estimated to have cost $14 billion each month alone, and that's without added expenses on the NHS and COVID-19 research and vaccine research. With many people also now being stuck at home, people had to adjust to this change. However, people on the front lines were still working, such as the NHS, nurses, social care workers, and so on. I recently interviewed Susan on how the pandemic had affected her life as a nurse.
My name is Sue Agger, and I'm a healthcare worker in complex care.
So would you say the pandemic over the past year has affected your day-to-day life work as a nurse in any way? And if so, how?
Well, yeah, it's more harder, if you like,
Mm,
to, even though we've all washed our hands the whole time
yeah.
and wore PPE before for years,
Mm,
it's just, I'll just say, it's like it's just there. You're terrified. You've got to. We're all just scared of catching this COVID.
yeah.
So it's more like you're more aware of it. You want like enough gloves, enough masks, enough aprons, everything. It's just you're just scared.
Yeah. Like,
But I have just had my COVID jab, so I don't feel as scared now.
obviously, because it's everyone's very aware of it, so
Yeah,
everyone wants to be very protected from it.
well that's it.
Has your home life changed at all due to the pandemic? Like, do you do anything differently? Any like different routines?
Well, no, because everybody's stuck in the house, aren't they? The kids can't go to school,
Mm,
so they're supposedly supposed to do homeschool, but they don't. They do it sometimes, but it's different because when you're in school, the teacher's there and you do as you're told and you listen to the teacher. You don't listen to your mum and dad,
yeah,
when you're a kid. And you don't want to do it because it's not the same, is it, as what is when you're at school. So it's more like, saying that though, I'm at work most of the time, so
yeah.
I don't really get it all. Paul gets it all with them.
Mm,
So I don't get that bit, but it's hard work trying to do school when you're not a teacher.
yeah. How do you think the UK has handled the pandemic as a whole? Would you say we acted pretty late compared to other places?
I would say so, yeah.
Yeah,
I still can't believe the borders are open.
yeah. I
Um,
didn't realise that today.
they're still letting people in, and
Mm,
I mean, Boris has done what he could. Whoever would have been in power
mm,
would still be getting all the grief he gets, but I do think he should have acted quicker and shut the borders. Like Ireland, they did the right idea.
yeah.
They shut the borders and they're all clear now and don't have to have masks or anything. Whereas we're still behind.
Mm,
People still getting it. Our hospitals are jam packed.
yeah.
So I do think, yeah, Boris should have done it quicker.
Mm. Going back to lockdowns, do you believe the lockdowns that have been put in place by the government have been effective in reducing the spread of the virus?
Yeah, definitely.
Mm,
But saying that, there's still so many people, isn't there? The soft ones that will still go out,
yeah.
and all like the parties they've been stopping, all the ones that think they're not going to get it.
Mm.
But yeah, I'd say it's worked. Everyone just has to stay in and do as they're told, don't they?
Yeah, that's how it is going to be.
It's whether they will or not. That's the problem.
Mm. Do you think more support could have been given to people working on like the front lines dealing with the pandemic? Because there was some obviously news about people working on the front lines that like needed more support.
Probably because if you're working like 12, some would probably doing 24-hour shifts, but if you're working constantly in them conditions, you can't take your masks off. You're fully
Mm.
covered, and people, you don't know what it is to start with, and the amount of people dying around you,
Yeah.
it's going to have an effect on you, isn't it? So maybe more emotional support, or
Mm.
I don't know, more. I know that they're struggling with staff at the minute,
Yeah.
but they're taking on all of the new nurses that are about to start in September. They're bringing, because I work with a girl, they're
Mm.
bringing them all in early
Oh.
to work in the hospitals to make more staff.
Mm.
So it's all down to staff. I think there's just not enough, is there, for the amount of people.
Well, would you say the NHS, are you yourself worried about the NHS possibly becoming overwhelmed?
I think it already is. I think it already is overwhelmed. I think, but I do think they've done an absolutely amazing job.
Obviously.
You can't fault them. They've gone above and beyond. So, but I do think they are struggling
Mm.
because there's just too many people, in the country, isn't there? And
Yeah.
you know, not enough doctors and nurses.
And
But I do think we've done a good job
yeah,
up
and
to now.
you hear now, obviously, like they're only allowing like people in if it's like an emergency, that they can't just allow anyone in anymore. So it's clearly very tight-fitted.
Yeah.
So lastly, with it coming to almost 1 year with COVID-19, do you think there is an end in sight, such as with the release of the vaccines? And do you think things will truly get back to normal afterwards?
No, I don't think we're ever going to have normal again, because I don't see. I mean, it's a year on and we're still all staying in.
Mm.
We're still wearing our masks. We're still, you know, not touching. It's just totally different life now. I'm so used to wearing a mask, I forget I've got it on. You know, I'm so used to wearing them. So, and I do feel better having had the first vaccine, but you're still not 100%, you know, covered. I do think if everybody gets the vaccine, the full dose, you know, will be a lot better. But I think we're probably going to have it each year, like we have the flu jab.
Yeah, probably.
You know, to keep it at bay.
All the new strains coming out, you're going to have to be eating.
Yeah, but I can't see us being back to normal for a few years. Yeah, so much, you know, the long-term effects of COVID, because some of the people I've worked with have had it, and that some of them are only young, and the long-term effects are worse than the COVID, what they've been left like. So I don't think, you know, I think we've got a while to go yet before we can ever like be back to normal.
Well, thank you for your time.
That's okay. You're welcome.
With all non-essential shops and businesses closed, this meant people had to spend a lot more time than usual at home. Some handled this well, while others not so well.
I'm on a walk with my dad. Dad, how are you enjoying this walk?
For me personally, it highlighted what little change in my life a national lockdown and a whole pandemic can have, and how I need a schedule where I go to sleeping at 7 AM and waking up at 7 PM every day, and a proper work environment to concentrate on work. The mental strain of being stuck indoors began to emerge for people over these few months. Many people had to adapt to doing everything online. Families wanting to talk to each other began using Zoom, Skype, Facebook Messenger, WhatsApp. All these new video messaging services became the new normal for seeing someone. Older people had to learn how to use these modern services if they wanted to stay in touch too. This meant lots more people began talking to each other as a result. People who you haven't spoken to in a while would check in to see if you're okay. We would stand outside at 8 o'clock every night to clap for the NHS. And while obviously the NHS have played a massive part in helping out with the whole pandemic, let's not forget the smaller roles that have played just as much as a key part, that have kept the world turning during these unprecedented times. It seems society has become a lot more caring for each other due to the results of lockdown. After what felt like years, on May the 10th, Boris Johnson announced the start of relaxing phases of lockdown. However, it wasn't until June the 1st that the majority of places were allowed to reopen properly.
I know everyone will be looking forward to the relaxation of national restrictions. As lockdown eases, we should focus on supporting the livelihoods of business owners and their employees up and down the country, all of whom are opening their doors for the first time in more than 3 months. Our goal remains to enable as many people as possible to live their lives as close to normally as possible in a way which is as fair and as safe as possible.
Fresh air once again. With the lockdown proving effective, it meant people could go back to their lives, and it would stay this way for a while. Although cases were still popping up, the initial R rate of COVID had dropped. However, it was still instructed that you self-isolate for 10 days if you had any of the COVID-19 symptoms. Months passed by, but things were gradually returning to normal, with a few exceptions. The introduction of the 2-metre social distancing rule to prevent spread, and the requirements to wear face masks when in shops. Numbers of gatherings were increased, shops opened back up, with new health and safety guidelines. Pubs and restaurants opened up again with a push for #EatOut to help out, alongside the new track and trace app. Events were allowed to start up once again. The world went back to some sense of normality. However, September saw a second wave on its way.
Obviously, we're looking very carefully at the spread of the pandemic as it evolves over the last few days, and there's no question, as I've said for several weeks now, that we could expect, and we are now seeing a second wave coming in. We've seen it in France, we've seen it in Spain, across Europe. It's been absolutely, I'm afraid, inevitable that we would see it in this country.
With the second wave in action, curfews were put back into place. Another spike of COVID rolled in, yet testing had been pushed forward quite a bit over the past few months, meaning a lot more people of the public could get tested for COVID. To talk more about her experience during this time, I had an interview with Andrew.
Hi, I'm Andrea.
So, if you don't mind saying, how did you come to find out that you had COVID?
I had my daughter was going to stay with her nan for a few days while she was home from uni. So we decided it would be safer if she got a COVID test before she went and stayed with them.
Yeah.
And because I was taking her, and I just thought, oh, well, I'll go for one as well. So we went up to Greasby, had a test, came home, and she came back as negative. And I said, oh, that's good, because you can go to your nan's now. And then about 2 minutes later, my phone pinged and it said I was positive. And I had no idea. That's how I found out.
What was going for the COVID test like? Like, what was that experience like?
It was fine. It was just a long queue, and you were in and out, really. Once you got into the building, it didn't take long, but it was fine. It was fine. And then, of course, I had to go for the second COVID test over in Liverpool Airport.
Yeah.
Which was amazing. They literally just drive through, and there was nobody else in front of me, and I was in and out within 5 minutes.
Wow.
It was quicker at Liverpool Airport than it was at Greasby.
Has having COVID had any leftover side effects? And if so, what were they?
Well, I got tested on the Tuesday, and I didn't have any symptoms till the Friday after.
Yeah.
And that was a loss of taste and a loss of smell. And they still haven't properly come back yet. I have got smell and taste, but not to the extent that I had before. But it literally just went. I couldn't smell or taste anything.
Yeah. I know someone in our work got it, and they said they can't, they get a tightness in their chest now.
No, I don't have any other symptoms other than my taste and my smell.
So during the time that you did have COVID, how did it affect your day-to-day life? What was different?
Well, obviously we self-isolated because Abby ended up testing positive as well.
Yeah.
And but my son, who we lived with, he didn't have COVID at all. But we were just really, really, really tired all the time.
Yeah.
I'd say the tiredness, the lack of sense of smell and taste were quite bad. I didn't have a cough. I did have a sneeze. I did sneeze, and when I first got COVID, I googled sneezing, and it said no, that wasn't a symptom. But by the end of the 10 days, they put it on as a symptom of COVID, the sneezing. It was just so tired, and of course not being able to take the dog out. So that was a real big effect of COVID, not being able to walk the dog, who's there now.
Do you believe with how the pandemic has been handled, it's been effective in stopping the spread of the virus?
Well, I work in a school as well, so of course I'm still going to work, and the upheaval to schools has been enormous. I'm a caterer, so I'm not actually in the classrooms, but it has had a major effect. And I think that yes, probably they could have done a lot more, a lot quicker, etc., etc. But I wouldn't want to be Boris. I would not want to have had to have made the calls.
Yes.
So I think that they are on as much of a learning curve as we are, never ever living through it before. But I do think that the vaccinations have been handled really well.
Yeah. Has being in lockdown changed your day-to-day routines as well? Like, would you say you do anything differently now?
Yes, a lot. Lockdown obviously affected us in lots of ways because we lost my dad in lockdown. We lost Uncle Rich in lockdown. And I'm in the middle of a house move that should be going through next week. But I think because I'm on my own, it's the isolation. And where I used to be always up, out, doing things, meeting people, going places.
Yeah.
I have never, ever, ever sat in my front room as much. So during the winter, I would say I've never been so just sitting around waiting for something to happen. Whereas in the summer, I spent a lot of the time outside. But it has changed my life enormously.
So with it almost coming to like a year with COVID, and like a year within like being in lockdown and stuff, do you believe an end to the pandemic is in sight, such as with the release of these vaccines?
I think that we'll probably live with COVID for a very, very, very long time. And I think it'll just become a normal thing, like the flu. I think that people will be more cautious in life. I think things will change because of COVID in our day-to-day lives. I think some people are wearing masks all the time. I think that I heard this morning that they're making cash point machines where they it was on the news this morning. Cash point machines are going to be self-cleaning so that they will not transmit. So I think that the knock-on effect of COVID will go on for a very, very long time. And I just think that really, I think we just have to live with it, to be fair.
The new normal.
Whatever that is.
Thank you for your time.
And it was not so long after the second wave before a second lockdown was also announced a month later, on the 31st of October.
In this country, alas, as across much of Europe, the virus is spreading even faster than the reasonable worst case scenario of our scientific advisors, whose models, as you've just seen, now suggest that unless we act, we could see deaths in this country running at several thousand a day, a peak of mortality, alas, bigger than the one we saw in April. And so now is the time to take action because there is no alternative. And from Thursday until the start of December, you must stay at home. You may only leave home for specific reasons, including for education, for work, let's say if you cannot work from home, for exercise and recreation outdoors with your household or on your own with one person from another household, for medical reasons, appointments, and to escape injury or harm, to shop for food and essentials, and to provide care for vulnerable people or as a volunteer. I'm afraid non-essential shops, leisure and entertainment venues will all be closed, though click and collect services can continue and essential shops will remain open, so there's no need to stock up. Pubs, bars, and restaurants must close except for takeaway and delivery services. Workplaces should stay open where people can't work from home, for example, in the construction and manufacturing sectors. Single adult households can still form exclusive support bubbles with one other household, and children will still be able to move between homes if their parents are separated. I'm under no illusions about how difficult this will be for businesses which have already had to endure such hardship this year, and I'm truly, truly sorry for that. And that's why we're going to extend the furlough system through November. The furlough scheme was a success in the spring. It supported people and businesses in a critical time. We will not end it. We will extend furlough until December.
With another lockdown in place, people began to worry what this would mean for businesses and the economy in general. With lack of finances, a lot of places had to close down for good. UK unemployment is likely to reach 2.6 million in the middle of 2021, according to the government's economic watchdog. And nearly 10 million people were furloughed between the start of the scheme and the 13th of December.
Luckily, the second lockdown only lasted a month, ending on December the 2nd, but was replaced by a new three-tier system, with one having little to no restrictions to three having more severe restrictions. It placed different areas of England under one of the three options based on the number of cases in their area. The area I was in was placed into tier 3 straight away. However, hope was on the horizon as the Pfizer/BioNTech COVID-19 vaccine was approved for use by UK authorities.
On the 11th of December 2020, my auntie passed away.
Age 78, her name was Barbara Stanley. She was a lovely, caring person, and my family will miss her dearly.
When trying to organise the funeral, her daughter, who was in Spain at the time, could not get back straight away due to flights being cancelled from the pandemic, meaning the funeral was postponed till the 15th of January. Other family members could also not attend due to the restrictions being put in place across the country at the time. All this added extra stress for the family members who were waiting so long. With Andrew's dad, only the cremation car was allowed, meaning family members had to make their own way there. And once the ceremony was over, which only allowed 10 people, you had to go straight home, meaning they could not grieve as a family. With my auntie, it was the first funeral I had ever been to, and it was strange with the effects of the pandemic. In worst cases, families had to wait till the end of lockdown till they could even begin to organise a funeral.
With Christmas fast approaching, people began to wonder what would it be like with the new tier restrictions, a Christmas like no other. What would be allowed, what wouldn't? Midway through the month, a new variant of the coronavirus had been discovered, which spread much quicker. And as Christmas was round the corner, on the 19th of December, Christmas plans for people changed drastically.
Yesterday afternoon, I was briefed on the latest data that shows the virus spreading more rapidly in London, the southeast and the east of England than would be expected, given the tough restrictions that are already in place. We must, I'm afraid, look again at Christmas. And as Prime Minister, it's my duty to take difficult decisions, to do what is right to protect the people of this country. Given the early evidence we have on this new variant of the virus, the potential risk it poses, it is with a very heavy heart, I must tell you, we cannot continue with Christmas as planned. In England, those living in Tier 4 areas should not mix with anyone outside their own household at Christmas, though support bubbles will remain in place for those at particular risk of loneliness or isolation. Across the rest of the country, the Christmas rules allowing up to 3 households to meet will now be limited to Christmas Day only, rather than the 5 days as previously set out. As before, there will be no relaxation on the 31st of January, so people must not break the rules at New Year.
So, with Christmas cancelled, the UK kept pushing forwards, watching New Year from their windows and the virtual firework display on their TV, as the clock struck midnight, bringing on 2021.
As January the 1st, 2021 began, the total number of cases in the whole of the UK since the beginning of the pandemic now stood at 2,000,000 689,033, and the death toll at 76,984.
4 days into the new year, Boris had yet another announcement to make as fears of the new variant grew.
With most of the country already under extreme measures, it's clear that we need to do more together to bring this new variant under control while our vaccines are rolled out. In England, we must therefore go into a national lockdown which is tough enough to contain this variant. That means the government is once again instructing you to stay at home. You may only leave home for limited reasons permitted in law, such as to shop for essentials, to work if you absolutely cannot work from home, to exercise, to seek medical assistance, such as getting a COVID test, or to escape domestic abuse. The full details of what you can and can't do will be available at gov.uk/coronavirus.
And so that's where we are today. With the third lockdown still in effect in February, it's clear that the effects of this pandemic will change how we think for years to come, and questions, will we ever truly go back to normal? The normal we knew has been changed completely and turned upside down, and we as a society have been permanently changed by the effects of this pandemic, such as we are now forever more aware of health, safety and hygiene. But with the new vaccines rolling out, 14,556,827 people have already received the first dose, and another 534,869 receiving the second dose as of today. There is hope, so an end goal is there. We must just keep going for a little while longer, together.